have safe places to live and opportunities to grow. Our vision is a world in which all youth are safe and valued in their communities. I'm going to talk to you today about the life-saving impact that Runaway Homeless Youth and Trafficking Prevention Act, I'm going to use the acronym for now on, RHYTPA, because that's a lot to say, transitional living programs have on the lives of homeless and trafficked youth. Transitional living programs, as defined by the RHYTPA, are designed to provide children and youth ages 16 through 21 years old the opportunity to build independent living skills and become self-sufficient with the support of caring adults in their own apartments. The young people who enter our TLP programs come to us with a panoply of challenges facing them. None are of their own making. They've been raised in households devastated by the opioid epidemic, ravaged by untreated mental illness, and struggling under the burden of poverty. They've survived the predations of criminal gangs and human traffickers, only to find themselves on the streets with only the clothes on their backs and their wits. The systems designed to prevent these calamities have failed them. Their schools lack the resources to meet their needs. The behavioral health and substance abuse treatment systems are overburdened with months-long wait lists. Child welfare agencies lack the capacity to meet the needs of families and children, and juvenile justice systems incarcerate youth simply because they lack a safe home to return to, not because they pose a threat to their community. Transitional living programs are a finger in the dike that holds back the growing tide of child and youth homelessness. We design these programs to help young folks move from crisis to stability while meeting their unique developmental needs. Children under the age of 18 need 24/7, 365 support and very remedial independent living skills development, while older youth may need more specific supports around keeping a full-time job, engaging in post-secondary education, military enlistment, and developing safe, pure relationships. While we and the youth work long and hard on these soft skills that will carry them into adulthood, the core focus of these programs is saving the lives of these young folks so they can grow up and move on to safe, stable, independent living in market rate housing on their own. The good news is that over 80% of youth who exit our TLP programs exit to safe, stable, independent housing after 18 months. Given what we know about their histories and extremely challenging life experiences, that is an amazing outcome that our nation should be investing in. The bad news is that we have 32 TLP beds in Lewiston, in central Maine, and we always have a waiting list for those apartments. This is rural Maine, right? We have a waiting list for homeless teens in the most rural state in the country. So for all the children and youth who do not get an apartment with us and are left to fend for themselves on the streets, we know the outcomes of that. Incarceration, graduation to adult homelessness, frequent emergency room visits, extended stays in psychiatric facilities, human trafficking, and death. You may think this is an over-dramatization. It is not. I see these realities every day in rural Maine. It's happening at an alarmingly increasing rate across the country. Children and youth are dying and being dragged, kicking and screaming into the criminal underworld simply for lack of appropriate safe housing. Reauthorization of the RHYTPA will ensure that as this national epidemic of youth in crisis continues, all our children and youth will have access to safe housing and supportive adults. For these reasons, I implore you all to support the reauthorization of the RHYTPA. Thank you.